Perfect.
Did that work?
There
I
we
clicked
go.
it.
Yes.
Okay. Fantastic. I apologize for that.
No problem.
So, conversion therapy. There's actually a very simple definition of conversion therapy. Conversion therapy is any set of practices that try to change a person's sexual orientation or gender identity. This is a really simple definition, but it actually covers a lot of things. The most common one that you're probably familiar with in the news is the sort of pray away the gay, church basement, primarily religious conversion therapy that takes place largely by unlicensed counselors who don't necessarily know the warning signs of or how to not be inflicting trauma on folks. There is also a large amount of this that takes place in doctors' offices, in psychotherapists, mental health practitioners of all kinds, even school counselors sometimes. And that is particularly dangerous for different reasons. You know, the religious conversion therapy is largely unregulated. The psychotherapeutic conversion therapy can sometimes be regulated. We are working on this in the States. And primarily the reason that we've gone after that is that these folks have a state license, have the trust of professional credentials, especially state-given professional credentials in gender in a person. We hear a lot from folks who are families, and when their child comes out to them, they don't necessarily know what to do. And it's not that they're bad parents, it's that they don't know what the right thing for their child is, and they don't want them to face a life that's much harder. So they go to the professionals who hold these licenses and say, please help my kid. And there are a lot of those professionals who are sort of combinations. There are a lot of Christian counselors, a lot of Jewish counselors, a lot of religious counselors who are also licensed, who incorporate a lot of scripture into what they're telling a child, which is inherently that how they were born is wrong and that something that cannot be changed needs to be changed. And the most dangerous part of that message really is the failure, that if you are not changing, it is because you are not trying hard enough, because you do not love your family enough, because you don't want it enough. And kids, especially at this vulnerable age, already suffering from minority stress, can take that message to indicate that they will never be able to change and thus will be isolated and unloved their entire lives. It's extremely dangerous. And it's been getting, finally, in recent years, some news attention. So you may also have seen this referred to as ex-gay therapy or reparative therapy or sexual orientation change efforts. We refer to it as conversion therapy for a few reasons. None of the terminology is really ideal. I do want to be upfront with that from the beginning. We are referring to this as therapy when it is in fact not. It is not ethical. It is in no way a medical treatment. We refer to it as conversion therapy because it's sort of the best of these options. Sexual orientation change efforts was a term of art created by the mental health industry to describe the early versions of this. It is obviously not inclusive of gender identity, which we're going to talk about in a second. And it also was created by the people who are doing this. So in some court cases, that can be advantageous. You see a lot of the older laws that use this terminology. But because it is so exclusive of gender identity and gender expression, we have moved away from it. There's the same problem with ex-gay therapy. It is a little more indicative of what it does, but it is not inclusive of gender identity, which is such a big part of what these efforts are. Reparative therapy, same problem. It sort of implies that there is something to repair, and this is the term of art created in large part by Joseph Nicolosi of the National Association for the Research and Therapy of Homosexuality, NARTH. It is a very specific kind of conversion therapy. It is one kind, and it is a particularly dangerous kind. It is largely done through talk therapy, shame-based, and under the impression that that LGBT identity is rooted in either distance from a mother or a father figure, depending on the gender, and early childhood sexual trauma, which is almost never true. What it does is it convinces these kids that they have been through some kind of trauma that they are blocking out, distances them from their families. We hear time and time again from survivors who have been convinced that something happened to them that they cannot remember. And they have stopped speaking to their families entirely. And years later, when they have found an affirming therapist or mental health professional who has sort of taken them through the steps of what a repressed memory really would look like, Sometimes it is too late for them to regain that contact with their family. Really tragic stories of people just dying too soon. So I want to talk about gender identity and expression for just a moment. A lot of, especially the earlier efforts, really did focus on sexual orientation primarily, and there are a lot of reasons for that. It is really just in recent years that gender identity has become more of a focus of the LGBT movement, and frankly, it's true that we have significantly less data on transgender individuals. We have very little data on LGBT individuals in general. It's really only in the last recent history that we've started gathering reliable data on this population at all, and transgender folks are the most frequently left out population within that. But what we do know is that the minority stress health risks that come with being lesbian, gay, or bisexual are almost always more severe for transgender and gender nonconforming people. So we know that being lesbian, gay, or bisexual comes with risks of substance abuse, of depression, of suicide, all of these mental health factors that very clearly track with minority stress that we've studied in other populations. Transgender individuals have extremely high suicide attempt rates, extremely high hate crime rates. They are at risk for everything to a degree that is more severe even than an already at-risk population. The other reason that we really focus on gender identity and expression is that conversion therapists and this industry and the theories behind the industry often conflate sexual orientation or gender identity. So in the 1980s, there was this case of this child named Kirk Murphy. He was the subject of the sissy boy experiments on Anderson Cooper a few years ago. And what happened was he was about 5, and his parents noticed that he was playing with dolls a lot and displaying what they considered effeminate behaviors. A man named George Riekers, then a graduate student at UCLA, was advertising on TV for boys who fit the stereotype of a sissy, for effeminate boys, coming into this experimental treatment program where they could fix them. So the family came in, they sent Kirk into this program. He stayed there for about 9 months. And it was based largely on reward and punishment, on operant conditioning, that when Kirk played with stereotypically male toys, he would get tokens that he would turn in later for rewards. When he played with stereotypically girl toys, he would get a different color token that later he would have to turn in for punishment that often involved beating. 9 months later, he exited the program, pronounced cured. George Riekers went on to build a huge career based on this success story of Kirk Murphy. And what we know now, unfortunately, is that when Kirk was 18, George Riekers met with him again, and Kirk said, "I'm gay, and I don't know what to do about it. I'm not out. I'm terribly depressed. I'm suicidal. Please help me." And George Riekers went on to continue publishing his success story in Kirk for years until Kirk wound up tragically committing suicide. So Kirk's story and what his sister Maris has been able to get out since has been a real lens through which we can view how sexual orientation and gender identity are conflated by this industry in young children. It is assumed that any gender nonconformity is going to be the source of some kind of either LGBT identity later on or transgender identity without really understanding the nuances in between. What we know about transgender children now is that whether or not they grew up LGBT or T, the most healthy thing for them is to be affirmed in their identity. We have data on this now. We are getting much more now that we are starting to study transgender children in this country. But like I said, we still don't have a lot of data. So what we do have is largely focused on sexual orientation, and it's very important for us to include gender identity within that because we know how much they have been conflated and because we know that the risk factors for transgender individuals are even more severe than for lesbian, gay, and bisexual individuals. So this is actually a lot of language from some of the state bills we've been passing that I'm going to talk about later. But there's a lot of debate about what conversion therapy is and isn't. It's actually very simple. It is any kind of counseling that involves trying to change sexual orientation or gender identity. It doesn't include what we call gender-affirming therapy, which is therapy for somebody who is undergoing a gender transition, a transgender person who is transitioning from male to female or female to male and having the support of a psychotherapist while doing that. It does not include anything that's seeking to prevent or address unlawful conduct or unsafe sexual practices. So this is based on something that is a common sort of confluence between sexual orientation and things like pedophilia or propensity to assault, violent fantasies, things that actually do lead to crime. None of these are actually sexual orientations. But we want to be very, very clear that none of this is covering that. We are only covering people who are trying to change, especially youth, from lesbian, gay, bisexual, transgender, queer, into something else. What's another thing to remember is that every single major medical and mental health organization in the country has issued statements opposing the use of conversion therapy. So this is from the American Medical Association. This actually echoes a court case in New Jersey that is happening right now against Jonah, the Jews offering new alternatives to homosexuality. And in that case, the other side tried to admit a number of experts who were conversion therapists so that they could defend their clinic against allegations that they had conducted consumer fraud by telling these kids that they could change them to straight. And what the court wound up saying was that any therapist basing their opinion upon the assumption, using this language, that homosexuality per se is a mental disorder is by definition not an expert and excludable from court. The American Medical Association, the American Psychiatric Association has another very strong statement talking about the risks of conversion therapy. Again, using sort of different language, but these are all the same thing. And the Pan American Health Organization. This is an important one because it actually led recently to a United Nations report that included conversion therapy in the section on torture and ill treatment. So myself and a survivor actually went to the United Nations in November and talked to the Committee Against Torture about conversion therapy in the United States. And the Pan American Health Organization was the first one to talk about these practices. But the United Nations has since come out just a few weeks ago and reiterated that this is an issue of human rights, of international human rights now, and cannot be condoned in the United States or anywhere. Another thing, and we're going to get into some of the scientific debate here, is that conversion therapy is not effective. So there's this great thing that I actually want to point you to right now. It's the Columbia Law School has recently released a website called the What We Know Project. And there they list every single study on a number of issues. And they recently released one on conversion therapy. And what is very clear is that while there are a couple of very old studies that do show some ability to change sexual orientation primarily, they are outdated, almost always have since been disclaimed by either the author or the publisher, and have enormous flaws in methodology. So Kirk Murphy is a great example of one of those papers that George Reekers continued publishing about. Several are self-selected groups of self-identified ex-gays or from within ex-gay ministries, extremely unrepresentative samples. So there's been a lot of scientific critique of these studies that do purport to prove that you can change sexual orientation or gender identity. On the other side, we have a huge number of former proponents of conversion therapy that have come out against it, particularly in regard to the ex-gay ministry programs, which are the largely religious ones. Michael Bussey, for example, who founded Exodus International, the largest ex-gay ministry program in the country up until about 2 years ago when the current president, Alan Chambers, shut it down and issued a public apology for the damage it had caused. Dr. Robert Spitzer is another great example. He had a few studies out there a few years ago sort of indicating that that change could be possible. And he has since retracted those studies, saying that there were methodological flaws that he knew about at the time and that his research since has been misrepresented. Then we get to the question of harm. This is a very tricky one. Professional organizations, while several have issued statements like this, are a little bit less inclined to come out with strong statements that this is harmful. The reason for that isn't that it isn't harmful. Anybody who has worked with this population knows the harm that this can inflict. It's that it is very difficult to get evidence on it. So Caitlin Ryan of the Family Acceptance Project is one of the only researchers to be doing research into this right now. And what she found was that youth experience conversion therapy as a form of family rejection. She found this almost unbelievable number, that as many as 1 in 3 LGBT people have been through some sort of conversion therapy, usually in their adolescent years, were sent out of the home for some form of conversion therapy. And we don't talk about it. We don't talk about it a lot in the LGBT movement. We don't talk about it a lot in the mental health practitioner world or the youth advocacy world, in part because this is so deeply traumatic that it can take years for people to talk about it. It is only recently, with the advent of the internet and a number of advances in civil rights, that folks have felt empowered enough to really come out and talk about this. And we are at the very beginning of people really being empowered to take control of those narratives and tell those stories. The fact of the matter is, though, that other than surveys like Caitlin Ryan's, actually proving harm would be really unethical. The experiment necessary to prove harm would be to take a number of young people, put half through conversion therapy and half through affirmative therapy, LGBT young people, and see who survived, which is not something that I would hope anyone is advocating for. What we know anecdotally, what I know anecdotally, running a survivor network of folks who have been through this and are empowered to speak out about it, is that we lose survivors every year. The damage that this inflicts, that I'll talk about on the next slide, is severe and lifelong, and it can be decades after it happened, and we still lose people. Kirk Murphy, in fact, committed suicide at 38, decades after he had been through it. But he traced it directly back to what had happened to him as a child. So a lot of you, I know, work with youth every day and are very trained to look for signs of trauma and ongoing trauma in those youth. And what I would encourage you to do is, in LGBT youth especially, look for signs of those ongoing trauma like any other: falling grades, self-harm, suicidal ideation. But when in combination with family rejection, it could be an indication that this kid is being put through conversion therapy. And because they are a captive audience, they are frequently being forced or coerced into it. And there's often a lot of shame about it. Like I said before, there is a mentality within this industry that if you are not changing it, it's because you are not trying hard enough. Setting up that shame from the very beginning makes it much less likely that these youth are going to be able to reach out. So it really is up to the folks on the front line, like I know a lot of you are, to look out for those warning signs, and if you see them, to put them in touch with advocates like us or several others that I'll list at the end. The harms that the American Psychological Association has identified through its review of all of the literature and research on this are listed here. It's been linked to depression, substance abuse, unsafe sex practices, guilt, hopelessness, shame, withdrawal. We see a lot of difficulty in interpersonal relationships, particularly romantic relationships later on in life. There's a lot of intimate partnership trauma. And as we know all too well, there is suicide. Suicide is a big risk. We had recently a very high-profile suicide in Leila Alcorn, a young transgender girl who was 17 years old and died just after Christmas last year, and skyrocketed this issue to national attention. And it was tragic, and it was horrible, and it is something that we deal with every day doing this work. This is some more data from Caitlin Ryan. So you can find out more about her research at the bottom, but I do want to say that this particular data listed on this slide is not actually published yet in a journal. What this is from is actually a sworn declaration in a legal case in California. After the law here was passed, it was challenged in court for constitutionality. and Caitlin Ryan came in and gave a lot of material that she has not yet published on this. It's very specific. It's based on a survey of hundreds of LGBT adults and young adults, talking about who has been through conversion therapy and what conversion therapy is related to when it comes to family rejection, which is the primary focus of her study. 8.4 times more likely to report having attempted suicide. That number goes way up even further when it comes to transgender youth, youth of color, and youth already involved in the juvenile justice system. So I'm going to talk a little bit about what I do, some of these efforts to end conversion therapy. Like I said, Born Perfect uses legislation, litigation, public education, and some administrative advocacy. And I'm not going to get too into the weeds on the legal stuff, but I do want to talk about the fact that the core of this campaign is the empowerment of the youth and survivors. So like I said, this can be very difficult to talk about. Talking about it can be re-traumatizing. Can bring up a lot of the same issues that came up before. But we also know that when it comes to advocacy, that is the first-person stories are the most effective by far. We never want to use anybody to the detriment of their mental health, though. So what we do in this campaign is we make sure that folks who are going to tell these stories are going to be doing so with support of an organization of mental health professionals behind them, knowing that this can be done in a way that is empowering and healing rather than re-traumatizing. That narrative construction actually has the ability to be a process of healing from this. So first we're going to talk about legislation. This is what makes most of the big news. And I'm going to use California as a little case study. In 2012, California passed SB 1172, which was a very simple bill. This is basically the language of it. It prohibits any state-licensed counselor or mental health practitioner from engaging in sexual orientation change efforts or conversion therapy with a minor under the age of 18. So there's basically 3 requirements here: a licensed mental health professional, youth under 18, actively engaging in conversion therapy. Then State Senator Ted Lieu, pictured here, saw the CNN special, the Sissy Boy experiments, and actually authored this bill right after he saw that. We were very involved in the authorship of that bill, as I think probably were some of you. The reason that this bill and that the bills since then have been so successful is that the drafting process was really unlike anything else we have ever seen. We worked incredibly closely with mental health organizations, with mental health practitioners, both in California and nationally, to make sure that this language is something that they could not only get behind but advocate for. Because one of the most powerful things about these bills is that it is in fact the industry asking to be regulated, not wanting the very powerful possibilities of psychotherapy and of mental health practice to be misused to harm anyone, especially children. So you see here, we had the support of this huge number of mental health organizations. This is actually not an exhaustive list, as well as civil rights organizations. And since we have added faith organizations, youth advocates, and reproductive justice advocates to that, in reaction really to who the other side brings out. The reason that this bill passed was largely because of the survivors who are willing to testify, who are willing to get up on a witness stand, who are willing to sit in front of legislators, often hostile ones, and tell the story of the worst thing that ever happened to them. But we did put those folks out there with the support not only of us and of the mental health practitioners behind us, but huge numbers of folks in California. We had a groundswell of support, and it wound up being an incredibly empowering experience for several of them, including Ryan Kendall, who wound up also testifying in the Proposition 8 trial. If any of you have ever seen the play 8, I don't know, he was played by the kid from Glee who played Kurt. Ryan is an extraordinary advocate. He was put through conversion therapy when he was a child, so detrimental to him that a court wound up emancipating him from his parents. He spent 10 years on the streets, homeless and struggling with substance abuse. And just last year, he graduated Columbia University summa cum laude and is headed off to UCLA Law School next year and wants to work on conversion therapy. So it's extraordinary how resilient these kids can be once they are given the opportunity to tell their stories. There's a little bit here about a direct tweet campaign as well. Jane Lynch got involved. We were all very excited. There it is. So there are also about 18 state bills introduced right now. We have passed bills now. We have passed laws now in California, New Jersey, Oregon, Washington, D.C., and just a few weeks ago, Illinois, although that has not yet been signed into law. We are hoping it will be. And the interesting thing, actually, about the New Jersey law is that it was signed into law by Chris Christie the same year he vetoed marriage equality. So we really have been able to get some legislators on board, even from a huge bipartisan base, even who can't get there on marriage equality. When it comes to the well-being of these kids, it really is something that we can all get behind. I also briefly want to touch on the federal legislation that is a pretty recent development in this. Ted Lieu, the same state senator in California who introduced SB 1172, has gone on to Congress. He is a freshman in Congress now and just introduced a bill last month to amend the Federal Trade Commission Act to basically define conversion therapy as consumer fraud. No matter the age of the person it's being practiced on and no matter the license of the person who is practicing it, as long as there is money changing hands, this would outlaw it. There's also been a couple of bills introduced by Jackie Spear and Cory Booker in the House and Senate, respectively, called the Shock Resolution, Stop Harming Our Kids, which basically calls on states like these to pass legislation of their own. I'm going to talk just a minute about the litigation. So there are two types of litigation that arise as a result of this. Defensive, which happens when we pass one of these laws, and then largely conversion therapists, religious organizations, very conservative right-wing legal groups challenge the constitutionality of these bills under the First Amendment. We have successfully argued those cases up through the federal circuit courts and gotten signed off by the Supreme Court in 2 different states now. We're expecting another challenge in Illinois and are prepared for that. But basically, the courts have not taken seriously the claim that this is restrictive of freedom of speech of the therapist just because their medical practice happens to take place through speech. This is, in fact, a reasonable regulation like any other professional organization and is much more akin to regulating surgery than somebody standing on a soapbox saying what they want to say. There are a couple of other main arguments, parental rights, religious freedom, that I'm happy to go into if any of you are interested, but I do not want to bore you with now if that is not your cup of tea. I do want to talk, though, about some of the offensive litigation as well. So I mentioned this Jonah suit in New Jersey right now. The Southern Poverty Law Center, who we work very closely with, has a lawsuit against Jews offering new alternative to homosexuality, which told a number of boys that they could change them from gay to straight, specifically gay male teenagers, and did so through some really questionable techniques that wound up really traumatizing them, including having them strip naked in front of a room full of boys and reenact sexual trauma. They have some incredibly courageous survivors actually going into trial this week to testify against the practitioners who they will be in the same room with. We've gotten that a few times in the state hearings as well. We have survivors come into the room and have to testify in the same room as their abuser, which is just difficult beyond imagination, and I cannot underscore the strength of the folks who are doing it enough. The other thing that we're doing is representing survivors individually, often in criminal cases. So we can, it's much more difficult to get at the religious-based folks through legislation, which is why the litigation you see is kind of focusing on more religious ministry type of conversion therapy. Because of the First Amendment, it makes it a lot more difficult. But it is not uncommon for conversion therapy in a religious setting to cross some very serious lines. So we have had clients who have had conversion therapy take the form of sexual assault and rape in an attempt to show these kids how bad being gay really is. We have had kids who have been through deliverances where they're surrounded by a church community and basically beaten bloody to try to get the demon of homosexuality out of them. So we represent those survivors and ensure that through these criminal cases they are empowered and not being re-traumatized to a dangerous extent, and that maybe we can even get them some justice. I also want to talk really quickly about some of the administrative advocacy, and again use California as sort of an example. The CIMFT has been very active in a lot of these efforts. They were active in SB 1172, and we've also had professional organizations in the aftermath of SB 1172 want to take it further. So implementing it requires, mental health practitioners policing themselves, basically going after other folks within their community who they see behaving unethically and reporting them. But in addition to that, I'm sure most of you know, mental health practitioners have ethical codes that they're required to live up to. And our position actually is that none of the state legislation is needed, is that these ethical codes through non-discrimination, through doing no harm, already have a number of sections that make conversion therapy unethical. So there have been a number of professional organizations in California working on trying to include under those ethical codes, under how they are implemented, conversion therapy not just on kids under 18, because it is already violating these codes even without SB 1172, even without a law. So they're trying to take the law that we have been able to pass and the public education we've been able to do around it and take it further, which has been just extraordinary. So the professionals really have been on the right side of this from the beginning and have been our biggest advocates. The public education of this is the most important part by far, and it is because we cannot get at everything through legislation. We cannot get at everything through litigation. We can't even get at everything through administrative advocacy. The way that we're really going to end this is by putting an industry out of business. And the way that that happens is by educating families. So most parents don't put their kids through this because they hate them. They put their kids through conversion therapy because they love them and they're scared for their future. A couple of years ago, if you searched conversion therapy on Google, you were going to get a list of conversion therapists. Now you get news articles and laws and statements from professional associations talking about how dangerous this is. And as a parent wanting to do right by their child, they cannot do this anymore without knowing the risks. So what we have been doing is going around trying to spread the word of this in really key communities, in faith communities, in mental health communities, in families, and in youth advocacy communities, the people who are really on the front lines, teachers, social workers, counselors, to make sure that not only are the families educated, but that the kids know that they are not alone in this, so that someone is fighting for them, that not everybody thinks that they are broken. There's another story I want to share with you of one survivor we work with very frequently who was raised by missionaries. So they had him going all over the world, to South Africa, to Venezuela, everywhere, spreading the Baptist missionary word. And they ultimately moved back to Florida. And when this survivor came out to his father knocked him down the stairs, put him in conversion therapy immediately. And on the first day of conversion therapy, this little 14-year-old kid was told that the U.S. government had gone through and killed every other gay person in the country, and somehow they had overlooked him, but it wouldn't be for long unless he changed. To us, that sounds ridiculous, but this kid had witnessed apartheid. He believed him. He absolutely thought he was going to be killed, that he was going to lose his family, and that nobody in the world cared about him, which is really something that we hear commonly. Not a story that extreme, but that isolation is a tactic used by this industry, and that our best bet at fighting them is getting accurate information out there and making sure that these kids know that they have advocates and legal options if they need them. As a little addendum to that story, I do want to say that survivor just last year graduated MIT with 2 master's degrees in nuclear engineering and policy, and now works on Capitol Hill advising Congress on nuclear waste, all with a red mohawk and high heels. He is amazing, and I have no doubt is going to be very famous someday. Okay, I'm going to talk a little bit about the opposition pushback, but primarily want to end this on a good note by saying that we hear time and time again from the same folks on the other side, people who currently identify as ex-gay, conversion therapists, religious groups, and parents. And the real substance of what we do is based on that. We highlight and lift up the voices of survivors, of mental health practitioners, of progressive faith leaders who see the damage this causes in their congregations, and of parents and families who have put their children through this, had their families torn apart, and now are the strongest advocates for their kids imaginable. So there is hope at the end of this, and it really does involve folks in these communities on the front lines, looking for warning signs, connecting these folks with information, and if necessary, connecting them with legal representation. So thank you so much. If you have any questions, I'm happy to answer them. I think that people have been typing things as this has gone on. But I'm going to hand it back over to Bill.
Great. Thank you, Samantha. And anyone, if you have questions, do type them and send them in. A question from a person in Texas. A lot of people in Texas and other places are circumventing legislation and intervention from professional organizations by framing themselves as life coaches rather than therapists, social workers, or counselors. This is a completely unregulated industry and is causing a ton of harm to youth and adults. What types of legislation are being enacted in response to life coaches providing reparative therapy?
That is a really great question, especially in some place like Texas, where there is a bill, but definitely no law. There are regulations already on mental health practitioners, on counselors, but definitely not on life coaches. You're absolutely right. And, you know, there are a lot of sort of modern technologies that are adding to this problem, that even in California, where conversion therapy is banned, there are still therapists here doing Skype sessions with people across the country, sort of getting around it that way, or saying that they're not actually administering therapy, they're just doing family consultations. They can get around these things a lot of different ways. The thing that gives me the most hope about this is actually Ted Lieu's bill in Congress, the one that would amend the FTC Act. And the reason is that it would get at all of this. It isn't limited to licensed mental health professionals. It isn't limited to psychotherapists or counselors. What it says is that if any money changes hands in exchange for conversion therapy of any kind, which is defined very broadly to be any efforts to change sexual orientation or gender identity, that is illegal. With the state bills that we're passing around the country right now, what the enforcement mechanism is that folks risk losing their license. Under the FTC Act, they can be fined. They can have their license taken away sort of in some very limited situations, but it's a much more civil remedy. It's very much empowering the victim and survivor to take action against the person who hurt them. So that can absolutely include life coaches and any number of the other newfangled things that are coming out these days.
So a follow-up to that, Samantha, then really the way that if the federal legislation passed, this could be taken on is through the individuals filing claims.
Yeah, as well as
right? Because money was exchanged.
Well.
Because money was exchanged.
Yeah.
So
it's like called the Therapeutic Fraud Prevention Act, and it would give individuals and the U.S. government as well. So the U.S. government has an interest in preventing consumer fraud. Has a whole agency devoted to that. So it would give a number of remedies to folks who had been through this and against these practitioners.
So there's some legislation that can certainly impact licensed professionals in some states, depending on the language in the legislation. Then there's this potential over the broader spectrum of folks doing this beyond the licensed professionals of consumer fraud or other kinds of claims being filed to try to take these practices on. Thinking about how there's a big trend now around religious freedom on the part of folks reacting to a lot of things such as this. Do you have any sense of how that's going to play out in the federal process, and whether or not you think there might be legal challenges to this ultimately that are going to go up towards the higher courts?
Yeah, so every legal challenge that we have had so far, and NCLR has helped defend these challenges in these states, in every state that it has been brought, has included a religious freedom claim. The courts actually haven't taken those claims very seriously. And the reason is this. It doesn't matter what your religion is. It does not actually give you license to hurt somebody. Religious freedom is not absolute. It stops at a certain point. So there were these very famous cases many years ago about Jehovah's Witnesses not allowing their sick children to be treated in hospitals. And what the court said was, you can feel free to practice your religion in any way you need to, but the line stops when somebody is getting hurt. It's not the only place it stops, but it's the primary place it stops. The thing is, though, that most people of faith actually aren't the kind of people who would do this to their kid. Faith communities, in large part, are actually good things for kids. They mitigate against all kinds of risk factors. And part of the damage of conversion therapy is that it takes this in many cases, very good resource a child has and takes it away from them all at once. Time and time again, what I hear from survivors is that the most painful part of conversion therapy for them hasn't been the shame, hasn't even been the sometimes physical aversive conditioning techniques like extreme temperatures or fingers being shocked. It's been losing God. That is the most powerfully damaging thing for them. And actually, a lot of them wind up going on to seminary and to become faith leaders themselves. But the religious freedom argument legally doesn't really hold water. Politically, what we have been working very hard on doing is creating alliances within faith communities. I'm a person of faith. That's where this work comes from for me. And it's very, very important that we encourage people of faith to advocate within their own communities when they do see this happening, just like it's important for anyone on the front line of any supportive community to advocate within that community. So we have some great faith leaders who have been out there very vocally supporting efforts to end conversion therapy and saying that they do not want their religion misrepresented in this way, in a way that is going to hurt people.
So staying with this area, you referenced the Jehovah's Witness beliefs and medical issues that happen. And for those folks of us who work in child welfare, we often have periodically had cases that came through child welfare where a court order needed to be put in place to intervene with a family that was refusing health intervention that doctors said was threatening.
Yeah.
And in states where there is legislation or even where there's not legislation, you know, we've often heard in some of our meetings with different child welfare folks around the work we're doing with getREAL, whether or not parents have a right to put their kid in conversion therapy or not. And do you think it's situations like that that might come to the attention of the child welfare system, whether there's legislation or not, a case could be made similar to the one that we do around the religious beliefs of Jehovah's Witnesses, for example, around medical treatment?
Yeah, absolutely. I mean, the story I told about Ryan Kendall happened, I think, about 15 years ago. A court even then could see how damaging the conversion therapy was for him and took him out of the custody of his parents because of it. There are many ways, even in states that don't have these laws, where it can become clear how damaging this is, even if there's not a physical element to it. But there are two sides of the coin here. I mean, we also know that conversion therapy is a major problem in systems of care. in foster care or even juvenile justice facilities where there are captive audiences. We have kids who are being forced into this as well. So we have to make sure sort of on both sides of the coin that these kids are being, that someone is watching what is happening and that they know that they have an advocate.
Thanks. Another question around the research. You referenced it's not published yet. It's a survey document that Caitlin Ryan did and used in some testimony, I guess, in some of the legislative processes, where 1 in 3 reported having some form of conversion therapy. Do you remember or recall if there were any demographic information around the people, the adults and young adults who were surveyed, around how many were system involved or people of color?
That's a great question. I know that the racial data was there and was largely representative. Although, as I recall, there was a sort of majority Latino folks within the survey. But you know what? Actually, I would actually just direct you to the survey. The
Sure.
document is available on the Born Perfect website at nclrights.org/bornperfect. Yes.
Oh, okay, great. Okay, well, that's it for the questions. Samantha, thanks so much. This has been
absolutely. Thank you all so much for having me. If anybody
let us
thinks
know
of questions, feel free to email me.
Right, and is there any way folks on the line can support the campaign?
Yeah, absolutely. So the first and foremost, most important thing is for folks on the front lines is to make sure that any young people who you are in contact with who are going through this know that there is legal representation available to them and that they have options. But if you want to get involved in the campaign in a more advocacy sense, absolutely go to the website, email me. Having youth advocates, mental health professionals who have seen firsthand the damage that this causes is really powerful, because often enough it is difficult to get survivors to a place where they can get up in front of sometimes a hostile legislature and tell this story. But if we have mental health professionals, youth advocates, folks in the child welfare system, even faith leaders who have seen firsthand the effect that this has on their patients, on their congregants, on the cases that they're assigned to, it can really make it much easier for a survivor to get up there or even not feel like they have to get up there. So if you have any firsthand experience with that, it can be invaluable. And if not, if you just want to get involved and fight some of the good fight, we have ways that you can do that too, writing op-eds and letters to these legislators. If you are on the front lines, you have a really powerful voice and can make a big difference in this.
Great. Thanks so much, Samantha, and thanks for all the work you're doing.
Thank you.
All right. That takes care of the webinar. Next week, we have a webinar on June 16th at 2 Eastern, which will be on a publication that's being developed called Be Fierce, around how young people advise folks who work with them they can effectively talk to them about sexual and identity development. So take care. Thank you.